Hello, I am Dr. Olga Acosta-Price, clinical psychologist and the director of the Center for Health and Healthcare in Schools, which is at the Milken Institute School of Public Health at the George Washington University, where I'm also an associate professor. Thank you for watching this short video where I'm going to talk about how the District of Columbia has been working to provide and improve behavioral health services to children and youth and their families in public schools and public charter schools for the past 20 years. This grounding will provide the context and the background to understand the current comprehensive expansion in school behavioral health that we're going to describe in video 2. Let me start by saying that far too many children and youth in the District of Columbia face tremendous challenges that interfere with their health, their well-being, and their ability to learn and thrive in school. In fact, more than 47% of children and teens in DC have experienced at least one adverse childhood experience, and the impact of these adversities can have a true negative effect on school performance and the ability to lead a successful life. Furthermore, 1 in 5 children has a diagnosable mental health problem, yet it is estimated that only 21% of those children receive the help they need in a timely manner. In addition, DC youth are more likely than their peers to be in a physical fight in school, to attempt suicide, and to use a number of illegal substances. So given this backdrop, it's essential that the district continue to prioritize behavioral health services for its children and youth, and it's equally important to provide these services where young people are most days and in a setting that is so influential to their development, which is in school. The District of Columbia began to really focus on implementing effective behavioral health services in schools in the year 2000. In the summer of 2000, the District of Columbia's Department of Behavioral Health received a grant called the Safe Schools Healthy Students Grant from the U.S. Department of Health and Human Services to establish a school mental health program in 16 public charter schools. The program provided an individualized plan for each school that focused on prevention, early identification, and intervention services for students. It also placed a full-time or a half-time behavioral health professional in each school to work alongside school-hired behavioral health staff. By 2006, the program had expanded into 43 public and public charter schools. In March of 2010, the district increased its focus on improving behavioral health support in schools after a tragedy that involved 4 DC youth who were killed in a shooting. This remains one of the deadliest shootings in the history of the District of Columbia, and in the wake of this heartbreaking event, the South Capitol Street Memorial Act of 2012 was enacted, which enabled the city to expand the school mental health program to serve an additional 30 schools, providing funding, training, and infrastructure to support and improve behavioral health services for students. In 2016, the district government enacted the Youth Suicide Prevention and School Climate Survey Amendment Act. This act served to further train and equip schools and staff with greater skills, tools, and resources to recognize the warning signs and risk factors of youth mental health crises, including suicide, and to implement best practices for prevention, intervention, and postvention supports following a suicide. Which brings us to the present day. In 2018, the city embarked on an even more ambitious vision, committing to a phased-in expansion of comprehensive school behavioral health supports in every DC public and public charter school. The expansion promotes comprehensive school behavioral health, which advances healthy school environments, strong referral processes, and effective teaming practices among various school-based partners to ensure that the full continuum of supports are coordinated, integrated, and beneficial to all members of the school community. And then in 2019, the city created what's known as the DC School Behavioral Health Community of Practice, what we call the DC COP, to support this expansion. In short, the DC COP provides a space for using interdisciplinary problem solving to support the implementation of best practices in school mental health. The COP is a place for the community to learn, to test, and to acquire new strategies that can be confidently shared with their own school-based teams. All DC public schools and DC public charter schools teams are encouraged to participate. For the 2020-2021 school year, 161 schools will be involved in the DC COP with the goal that over the next several years, every public school and public charter school will be a part of it. So that's a history of the district's commitment to providing quality, comprehensive school behavioral health services to children. Thank you for watching.